This video is brought to you by Saraswati Vidyalaya Union and this is Prapti. Today we are going to study about the angiography from respiration and circulation chapter. Now let's see.
Now the next technique that we are going to study, so that is related to the heart disorder only. But this technique, which is very important for the identification of the blood vessels blockages. Okay, so that technique, like a sonography. In the sonography, if something wrong with our stomach, okay, so that time that sonography is indicating that problem. So like that only one of the technique is there. So that technique which are indicating the problems related to the heart. That technique is indicating the blockages of heart. So this, which technique is this? Now let's see about the technique that is known as the angiography. So that technique, it is known as the angiography. Okay, so this technique which is known as the angiography. What is this angiography? Now let's see the definition. This angiography, it is X-ray imaging. It is X-ray imaging of cardiac blood vessel. It is X-ray imaging of cardiac blood vessel to locate. See that X-ray. Many times we are taking X-ray of our body. So in that X-ray we are getting the information of what? Of our bones. Wherever the bone there is that bones are broken, so that we are getting that information. Now here this is the X-ray technique of what? Cardiac muscle. Here cardiac blood vessel, that very important to locate the position of blockage. Position of blockage, it is known as the angiography. In this angiography, in short I'll explain you here. Suppose there are few blood vessels are there. So one of the blood vessel is there, that is known as a coronary artery. Okay, all of you knows that this coronary artery provides oxygenated blood towards the heart. This is the heart, and this coronary artery which provide oxygenated blood towards the heart. But here what happened? Due to the different factors, if suppose this artery get blocked by the different reasons. For example, there is a deposition of fats here. Due to the continuous deposition of fats, so here that blood cannot flow properly. Okay, so then there is less, that blood cannot flow properly, and then that heart is not getting oxygen. Whenever heart is not getting oxygen, so then there is a damage of tissues of that heart, damage of muscles of that heart, and then there is the chances of heart attack. Okay, so to prevent from these, this heart attack and all the many disorders, so this is the one of the technique, that angiography, which is using to identify these blockages. Okay, so here these two medical procedures are useful to remove these blockages. The first medical treatment is there, that procedure is there, that remedial procedure is there, that first one which is known as the angioplasty. That is known as the angioplasty. And the second technique is there, that is known as the second remedial procedure is there, that is known as the bypass surgery. We are always saying a bypass road. Okay, if one road is blocked, so we are going by the another road, we are choosing the other road, so that is bypass. Okay, so here you will get information afterward. Now let's see about this angioplasty. Okay, in the angioplasty, so if suppose there is a blockage of that blood vessel, see this is the blood vessel. and due to the different reason means there is age is one of the factor is there. If that person is consuming too much alcohol, that is one of the factor. Hormonal changes are there, so many factors for this blockage of this artery. And whenever there is a blockage of the artery means whenever there is a deposition of fats in this artery, if that deposition increases, so one day, so there is a blockage of that artery. So to prevent these blockages of the artery, so here the technique which is used, that is known as the angioplasty. And here what happens, if suppose blood, once again I'll tell you, if suppose this blood is not flowing properly, then that particular part of the body is not getting blood. And if that body part is not getting blood, so then there is a damage of that body part. If suppose heart is not getting the blood properly, that oxygenated blood properly, so then there is a chances of heart attack. So to prevent from that heart attack, so this technique is used, that is known as the angioplasty. So what the doctors are doing in the angioplasty? In the angioplasty, doctors are inserting stent. So what is the stent? See this. Doctors are inserting that stent into this blood vessel. How they are inserting? Through that femoral artery. So the artery which are present in the legs region. So through that artery, they are inserting one tube-like structure into that artery. So at the end of that tube-like structure, so there is a presence of the balloon. Okay, then they are inflating that balloon. When that balloon get inflated, like this, they are inflating this balloon. Okay, so due to that inflation, so then what happens? So these flap get removed from this region due to the inflammation. See this, like this, they are inflamming this balloon. Means they are making passage for moving that blood flow. For easy blood flow, it is very important. For easy flow of blood, this technique is important. Now here, after inserting this balloon, they are inflating that balloon and then they are removing that balloon. After that, then doctors are using one metal thing. That metal thing, so which is like this. Then they are inserting and then they are keeping here to prevent that increase in the flux. That metal object which is placed in the blood vessel, so that metal object is only known as the stent, and then it is kept it like that only. So due to that, what happened? Due to that, then there is a less chances of the blockage of that blood, that arteries or the blood vessel. That is known as the angioplasty. Angio means blood vessel. So here, now the next technique is there. So that next technique, which is known as the bypass surgery. Name itself only gives us information. Bypass surgery means what? If suppose there is a blockage of the artery here due to the different region. If suppose plaque is present, or you can say that if suppose this artery is the atherosclerotic artery. Okay, atherosclerotic artery. So at this region of the atherosclerotic artery or that atherosclerotic region, so this atherosclerotic region is bypassed. This region is bypassed with the help of what? With the help of vein or artery. With the help of vein or artery, which is taken from any other part of the body, but that part should be the suitable for these technologies, suitable part of the body. is now known as the bypass surgery. Means what they are doing, what the doctors are doing, they are taking the artery from hand region, from the arms, either from the forearms or the hind arms. From that arm they are selecting the artery, then they are inserting that artery in this region. Okay, or I'll show you here. Then they are inserting this artery here. So this artery which they are selecting, the doctors are selecting, so that is selected from the own body part. So then here what happened, due to the blockage, that blood cannot flow here. So here what happened, after passing, after just inserting this artery, that blood flowing in this region, and then that blood flowing towards that body part. So this is known as the bypass surgery. Explain you today. First one, angiography. Angiography, it is an X-ray imaging technique which is used to identify the region wherever the blockage is present. Okay, in the two methods are there. One is known as angioplasty, that remedial things are there, that is angioplasty and bypass surgery. In the angioplasty, the metal instrument which is used, that is known as the stent. So it is very important to prevent the deposition of fats at that region. Okay, then bypass surgery is there by using the hand or the leg's artery. So by inserting that artery, by operating that artery, by bypass, they bypass this